30 years of changes in law have brought the private sector into the NHS in England as partners at every level of the organisation. Reshaping the NHS as we knew it goes beyond underfunding and outsourcing. Structural changes to the NHS are removing and reducing access to care in GP surgeries and hospitals. In October 2014, the CEO of NHS England produced a 5-year forward view, continuing 30 years of changes to the way care is provided for patients, moving it away from hospitals. Instead of the familiar NHS provision, each new NHS area is developing a major trauma centre, usually located in a metropolitan area. Remaining hospitals that have not been sold are becoming satellite or local hospitals, no longer taking emergency or acute care patients. When the state's direct provision of healthcare, its facilities, staff, beds, treatments, is reduced, two kinds of market opportunities are created. A role is created for the private sector to be commissioned by the state to provide services in the state's place, as is happening now, or for people to have to pay for services privately, if they can, or do without if they can't, which is increasingly the case. The private sector understands this. The PR image of NHS integration, set out in NHS England's plans from 2014 and 2019, is one where local authority social care takes a greater role combined with primary care to move care out of hospital settings into the community. But local authority services have been cut to ribbons by draconian budget cuts. Previous care in the community initiatives were targeted at mental health, which lost many specialist hospitals and has left the country with both massively increased private provision and an overall shortage of services. Many of the private services are inadequate and even dangerous.
Amy, who was 14, died during a 3-month stay at the Priory Hospital.
A senior figure at US company Acadia Healthcare, which owns the Priory Group, which operates mental health services under the NHS logo at more than 500 sites with over 7,000 beds, said,
"We would look forward to, or hope does occur, is that the NHS continue to close beds and have a need to outsource those patients to the private providers. We think that are optimistic that if the NHS closes more beds and outsources those, we would be the big winner there."
There has been public pushback, especially locally, to closures. Public sentiment is high for the NHS, for example, clapping during lockdown. And We Own It show that even now, after years of black alerts in A&E, 86% of the people prefer public providers to private ones. That accounts for it taking 30 years to get this far. No politician wants to be in the government that's remembered for dismantling the NHS and replacing it with something that looks like Medicare. Would you write to remind your MP of that?